CanCOVID is an open science collective dedicated to rapidly mobilizing and sharing knowledge to help inform Canada's COVID-19 response. To learn more about us or how to join our community, you can visit our website at cancovid.ca.
Hello, everyone, and welcome to our CanCOVID speaker series. Thank you for joining us. I'm delighted to welcome Dr. Timothy Caulfield, who will be presenting to us on the latest research on evidence-based debunking and the Science of First Misinformation Initiative. Dr. Caulfield is the Canada Research Chair in Health, Law and Policy, a professor at the Faculty of Law and School of Public Health, and also the Research Director at the Health Law Institute, all at the University of Alberta. So before we get started, just a few items to note. All the audios and videos are disabled for our participants, but we do welcome you to ask a question or say a remark in the chat box at any point during or after the presentation. And just to let everyone know that this session is being recorded and will be posted on CanCOVID's YouTube channel. So without further ado, I'll hand over the floor to Dr. Caulfield.
Thank you. Thank you so much for this opportunity to talk to you today about something I'm really passionate about, and that's fighting misinformation, especially in the context of COVID, but more broadly. And I think that more broadly point is really important, because I think we've learned a lot about fighting misinformation as the result of the misinformation that's been spread around COVID. And I really believe that all this new empirical evidence is going to inform how we debunk going forward. Now, spoiler, I'm going to give you the ending. There's good news. I think there is good news. And the good news is debunking works, and it has worked even in this context. But we need more of it. We need more of it. So that's my conclusion. Let's get started. Yeah, you guys know this. There has been so much misinformation about COVID right from the beginning. Misinformation about the source. It's 5G technology. No, it's not. About cures. Yes, cow urine has made an appearance. Bleach, hydroxychloroquine, and now, of course, we're hearing about the vaccine. So it really has been an infodemic, as the World Health Organization called it over 15 months ago. I love this term. I think it really captures what's going on. This is about information. It's about information that does harm, and it spreads like an infectious disease. And we have to figure out how to push back. As I said, we are hearing more and more misinformation about the vaccine, and it's doing real harm. And we have evidence that tells us it's doing real harm. So, misinformation about infertility. No, there's no relationship. Misinformation about the idea that the vaccine will change your DNA. No, it won't. Now we have the idea that the vaccine will result in the shedding of dangerous viruses. No, it won't. But we know these things are out there, and they do real harm. They do real harm. And the other thing that we're seeing is this interesting, fascinating normalization of misinformation. This is a picture I took not that long ago, just a couple weeks ago at my local grocery store. This is one of those rags, those newspapers. Yeah, they're not credible, sitting right by the checkout. And I see this headline, and my head explodes. This may seem trivial, but it matters. It's this subtle normalization of misinformation rhetoric that can do real harm. It washes over us. It plays to our cognitive biases, availability bias, negativity bias. And again, it matters. This kind of fear-mongering matters. And yes, we are hearing more and more about these bunk cures. This continues to be something we're studying a lot at the Institute. One of the biggest themes out there, one of the biggest themes around the spread of misinformation. So you have this story, anti-vax family drinks their own urine. By the way, urine had a big year, right? You had cow urine, you got dog urine. Yes, people are drinking dog urine. You've got this kind of urine. I also love that it's an anti-vax family. They're against vaccines, but they're pro drinking urine. But as absurd as it sounds, this noise has an impact. Okay, but let's start with the good news. Let's not let this slide. There has been a lot of great news. This is the most recent data on vaccination acceptance. Look where we are, up to 82, and I think it's even higher now. This was quite recent, a couple weeks ago. like 10 days ago. And we can see that we're up to 82% acceptance. And we see that movable middle going down and the individuals in that movable middle migrating to the acceptance individuals. That's exactly how we want to see this graph play out. We've seen those hardcore deniers be kind of flatline, but we can't give up. We have to do more. This is great news. And I think, by the way, this great news is the result of really good science, good surveillance data. It's the result of cohort effect, people seeing their friends and neighbors and community getting vaccinated, but it's also about good science communication, what we're talking about today. But we can't stop. We've got to keep it up. We absolutely have to keep it up, because I think we're going to start hitting these hurdles. We're going to hit the complacency hurdle, right? Individuals that maybe don't feel strongly one way or another about the vaccine, but they're complacent. What can we do? And we have to be very careful not to overgeneralize. Within all of these broad categories, there's a diversity of views. So we also have to remember to always listen. We hit that complacency hurdle. Then we're going to hit the hesitancy hurdle a little bit higher, a little bit tougher. And then, of course, the deniers. We've got to try to get over all those hurdles if we want to get to herd immunity. So this is so important. I'm a big track and field fan. I just wanted an excuse to show this slide. Okay, so the other thing that it's really important to recognize is that this is largely, not entirely, but largely a social media phenomenon. And lots of research over the last 14 months have established that. We've looked at this from different methodological directions, and I think it's fair to say this is the case. The other thing we can say is, yeah, it's social media, but it's also US social media, which is very interesting and important, because I think that flow of information, that flow of misinformation from the United States pushes the polarization, facilitates the polarization that we're seeing in Canada. So I think that's important, that ideological spin that's starting to happen now with misinformation. But in addition to that, it highlights how difficult it can be to regulate, to challenge misinformation, because, it doesn't have borders, right? So this is important research, again, quite recent, just a couple months ago. And then research from July, the McGill study, and there's been other studies since this study that have backed this up. Bottom line, if you get your information from social media, from Twitter, Facebook, Instagram, more likely to be misinformed, more likely to believe misinformation. No surprise, right? But good to have that data. We also know, this is another study, I like this one. Again, it's from last summer, which feels old, right? Even though it's not even a year old, it feels like an old study. But I like it. It's kind of research that we do, so that's one of the reasons I kind of like it. But what they did is they looked at the history of the misinformation. They kind of traced back bits of misinformation to find their origin story. And they looked at over 7,000 bits of misinformation, and they found that over 4,000 of them had as their home, as their origin, Facebook. So again, social media phenomenon here. Okay, so who believes this noise? I could do an hour on this. This is actually a very complex question, and again, really important, big caveat to start with. People who believe in misinformation, susceptible to misinformation, believe conspiracy theories, come from absolutely every demographic. So we have to be very careful not to overgeneralize. And again, as I said before, always have to listen and empathize to get a sense of what's really going on. But having said that, we do have a number of studies, and I'm just going to give you a couple that give us a sense of who believes this. And again, it's not going to surprise you at all. This was a relatively recent study. Again, I'm going to say just a couple of weeks ago, Gordon Pennycook, a colleague in our CIHR grant on this topic, one of the co-authors, but finding that health literacy, critical thinking, trust, lack of trust, these things matter. No surprise, but it's good to know this stuff. And also these researchers and others have found that there is this clustering of attitudes, this clustering of beliefs. So you have individuals, for example, as they found in this study, who believe in alternative medicine, also more likely to be susceptible to misinformation. And there have been a number of studies that have found these exact results, and some of them coming out over just the past few months. This is also another recent study, which I think is really interesting and relevant to the work that we do. Basically asking this simple question: are you willing to change your mind? Now, those of us who have a science background, those of us who embrace scientific thinking, we are more likely to change our minds. What this study found is that individuals, and there's, by the way, this study again builds on other research. I think there's been a number of studies that have found exactly this, but this one again, very recent, I'm going to say 6 weeks old, so much going on in this space. This study found that those who believe in conspiracy theories, those who are more susceptible to misinformation, less likely to integrate new information, new evidence to change their opinion, right? So this is important. This is important, right? Because it highlights challenges that we might face going forward trying to change individuals' minds. Now, the other thing is, I actually think this is also kind of ironic. I get a lot of hate mail. I'm sure there's people involved in this event who get hate mail. And paragraph 2 of my hate mail is always, Tim, you got to have an open mind to 5G and to hydroxychloroquine and to microchips in the vaccines. Keep an open mind. But, you know, I do try to keep an open mind, but do they keep an open mind? No, this research tells us they do not, right? So I think that there's a little bit of irony there. Okay, what is the impact of misinformation? You guys know this, but let's remind ourselves, this really, really matters. I really think this is one of the challenges of our time. Deaths, physical harm, hospitalization, really interesting research on the adverse impact on stigma and discrimination, property damage. Also, I think this is underplayed. Misinformation is having a real impact on our health and science policy. And I think the hydroxychloroquine debacle, just one example, right? And it's also just adding to the chaotic information environment. And that last point might seem like a throwaway, but it really matters, right? Because often the sole goal of people pushing misinformation is to create information chaos, right? That's the goal. So that really matters, that last point. And we also know that chaotic information environment can make it more difficult to tease out what's real and what's not real. It can lead to stress. It can lead to a whole bunch of adverse outcomes. So that does really matter. And of course, this information is having an impact on vaccination uptake, vaccination hesitancy, vaccination intention. Been a lot of studies have shown that. This is a well-known one. It came out, I think, in February. Heidi Larson's group from the UK, they do so much great work on vaccination confidence. But basically, her team was trying to tease out how much impact has misinformation had on vaccination hesitancy, and they put a number on it. So this is in February, but still, I think it really makes an important point. They found that about 6.2 to 6.4% of the current hesitancy is the result of misinformation. Now, that may not sound like a lot, but you guys know this. That's huge, right? That's a huge, huge number and really highlights the adverse impact of misinformation in this space. Okay, but this talk is really about debunking, what are the evidence-based strategies to debunk? And the good news is debunking does work. Now, you might be thinking, what about the backfire effect, Tim? Every time I talk about debunking, someone brings up the backfire effect. The reality is, most of the research since 2010 has either found no backfire effect or found that it is relatively rare. And this is using a variety of different kinds of methods. Yes, it's hard to study this well, but I think it's fair to say that you shouldn't let the backfire effect scare you away from debunking. So that's an important message for people in the media. It's an important message for scientists getting involved in this. And it's also, I think should give us some confidence that we can move forward. And one component of that backfire effect is this fear that if you debunk something, you're just going to be spreading the misinformation, amplifying it. Well, this is a recent study by 3 very well-known scholars in this space, by the way. They all do terrific work. And they studied this amplification concern and found, in fact, it is safe to repeat misinformation when correcting it, right? Even for an audience that's unfamiliar with it. So this is new to them. Even for that audience, it's safe to repeat the misinformation when you're correcting it. Of course, you've got to correct it well. And the other thing is we have lots of research now that tells us debunking works. This was a meta-analysis that came out in August. I had a lit review that came out almost the exact same time, came to the same conclusion, cause for optimism. This really does work, especially if it's done by experts. And I know there are a lot of experts listening to this event. So yes, it really does work. It really does matter. This was another really interesting study. Gordon Pennycook again involved in this one. And David Rand from MIT. This team's doing just incredible work right now. I like to say they're on fire. They really are. But this is an interesting one where they actually found that debunking, so doing something after correcting misinformation on social media, for example, was more effective than pre-bunking. Now, I don't think Gord et al. Are critiquing pre-bunking. Rather, I highlight this just to say, again, that debunking does work. It may not feel like it does, but it does work. I actually think we got to come after this from every direction. So let's pre-bunk, let's debunk. But this is, again, more good news in a very recent study. Yet another study showing, again, another recent one, again, from some terrific scholars that do a lot in this space. I'll do this really quickly. I just want to emphasize the evidence is here. Another study that found little or no backfire effects. So good news, right? The other thing this study found is, you get on social media, you emphasize the facts. It may seem obvious, but this study gives us a little bit of empirical evidence to back that up. But the real reason I'm highlighting this study is one of the conclusions they come up with I really like, and I think it's important to emphasize, is the value of creating shareable content. Engaging shareable content, so important. So no backfire effect, get on social media with shareable content, and you're golden, right? Okay, this is another very recent study. So much going on, hard to pick what to tell you guys about. But this study I really like because I do so much debunking. And sometimes it feels like people are annoyed by it or they're fed up with it. But this interesting study found that people really do appreciate online correction. They like debunking, right? In fact, they kind of see it as a public responsibility, right? So people value it, and they recognize how challenging it is, but they still think it's worthwhile and perhaps a responsibility. So this is good news and also kind of a call to arms. So this is a well-known study that came out summer 2019. I refer to it often. I think it was a nice from a methodological perspective because they kind of came at it from a bunch of different directions, but basically telling us what a good debunk looks like and what you want to do. Very obvious, but you point out good, solid evidence and highlight the rhetorical tricks used to push misinformation. This study also found, more good news, no backfire effect. Okay, so highlight the good science, highlight the rhetorical tricks to use to push misinformation. In other words, that's just a testimonial, or that's just a conspiracy theory. You're misrepresenting risk, and don't worry about the backfire effect. Having said that about the backfire effect, I think there's one thing we do want to think about, and this is highlighted in a very recent study, is avoiding countering misinformation, countering an individual on social media, because that just makes them defensive. So this was more work by David Rand at MIT, very recent study published just weeks ago. They found that if you counter someone on misinformation, and this is what I think sometimes people see when they think of the backfire effect, that individual is more likely to double down. So let's say you see a denier and they say something absurd and you kind of attack them on social media, they're going to respond with more absurd statements. So our view and our view of science at first is don't do that. Be constructive. You can use the misinformation as an opportunity to talk to the general public, but don't get in a fight with a denier on social media. It just isn't worth it, and it's going to produce more noise. The other thing you want to do is you want to act quickly. There's an interesting series of studies that highlights this. You guys probably know the 5G conspiracy theory was one of the epicenters was Woody Harrelson. And there's been an interesting series of studies that has emphasized how important it is to identify that misinformation, right? And delegitimize it quickly, right? Using legitimate sources. This was a very recent one from a couple of weeks ago, emphasizing that also. I like this analysis because it really calls for this kind of surveillance approach to battling misinformation. So we should develop systems where we kind of get a sense of, we surveil what's going on social media and have this rapid response system to countering misinformation as it emerges. And I totally agree with that recommendation. So I think there's kind of a sweet spot to doing this. You debunk at the right time, you use the right message, you use the right voice, and you aim for the right audience. And the other good news is, this is again a recent study. I've said that phrase numerous times. This study found that it really is the message that matters, not the popularity. And so that's great news. So even if your tweet doesn't go viral, it can still be making a difference if you hit that sweet spot. So what does the sweet spot look like? What do you want your tweet to what is your social media response, your counter? What should it look like? Well, these are my effective debunking strategies, my suggestions. It's not a comprehensive list, just some of my favorites. If you want to take a screenshot and share this, please do. So yes, you provide the good evidence. It does work. Yes, use clear, shareable content. point to those trustworthy independent sources, talk about the scientific consensus, talk about that body of evidence and the scientific process. There's interesting research that talks about how that does matter and can make your message more impactful. Yeah, I think it's important to be nice, be authentic, be humble, be empathetic. It can be hard, for sure that can be hard, but I think that's the best strategy, especially if you want this ongoing conversation. And remember to listen, always remember to listen. Let's get creative. Let's use those narratives. I always like to say creativity wins. Let's use humor. Let's use art. Let's use cartoons. Let's use those creative strategies to make our messages have traction. Yes, highlight those rhetorical tricks. Make the fact the hook, not the misinformation. And always remember, so important, the general public is your audience, not the hardcore deniers. And this is our initiative, Science Up First, #Science Up First, an initiative that tries to integrate all of the stuff I've talked about today. This is a very straightforward platform. We just want people to follow us on Twitter, on Instagram, on Facebook, and share the good content. So this is content that has been vetted by renowned experts. This is content that we believe, follows the values I've just talked about, that's positive, has diverse voices. Get out there and share it. And so become part of the #Science Up First team, because the goal is to flood social media with good content. And we think there's evidence to back up the value of doing this. We think we have evidence-based messaging. And we think this is hopefully a positive movement, #Science Up First, that will survive the pandemic and really encourage a culture of accuracy. With that, I'm going to say thank you very, very much for this opportunity. And I'll end with my two favorite words, as always, go science. Thanks, guys.
Thank you so much, Dr. Caulfield. Terrific presentation. We have many questions in the chat box, so we'll get started. So the first one is, do you have any data on the effect that the drop in cases could have on people getting a second dose of the vaccine?
I don't have any data on that. So I'm speculating. I'm kind of stitching together the evidence that I know that's out there. Don't have evidence specifically on that. I am worried that it will lead to more complacency. And there is a little, you probably know this, sounds like the participant may know this. There's a little bit of data from the US that they're concerned about that. And I have heard, I haven't looked at the background data on this, but I've heard that they're worried about 8% of the population sort of falling into that complacency bucket down there, which is pretty high, right? Pretty high, all things considered. So yes, I am worried about it. And I'm also worried that the misinformation that's circulating right now, coupled with complacency, is going to give people pause. And it doesn't take much, right? If you have, access issues, maybe you have needle fear issues, all these things combined that might just give us a situation where we have 2, 3, 4, 5% of people that aren't getting it. So it's a great question, and one I think we need to target with good messaging.
Thanks so much. So the next one is, how do you measure the assertion that that debunking is effective and that more should be done? And then the next question is, does it matter who is doing the debunking? For example, if folks don't trust the government, should the government avoid debunking?
So I'll start with the second one. So it has been research. It was research done early in the days. Now I bet you this has shifted. If we redid this study, it might be a little bit different. But that debunking that comes from public health authorities was actually viewed as being very effective. Also in Canada, despite what you often hear, there are pretty high levels of trust in Canada, and in the United States. There's a very recent study that has actually found that the trust levels are going up, which is really nice to see, right? Having said that, trust remains a big issue, and I think I'm hoping that one of the legacies of the pandemic is a greater appreciation of the value of trust. The other thing that we know, healthcare providers, your family physician, nurse practitioners, these people, these voices really, really matter. And the other thing that's really important when it comes to trust is people from your community. There's interesting research, not just done in this context, but in other contexts, was found that someone like you, right, someone from your community, your values, their voice matters, right? And that's why I think social norming and the cohort effect has been so effective in this space. So yeah, there are trusted voices. I think trust of government and institutions is going to continue to be a challenge. And I think that's why I have that, the right voice as part of my list of things to do. Having that right voice, trust, credibility, so important.
Absolutely. And so the next one is, how do you deal with debunking of factual information by those pushing misinformation? Or does the term only apply to those giving accurate data?
Okay, say the first part again of that question.
Oh, yes. How do you deal with debunking of factual information by those pushing misinformation? Yeah, maybe we'll go to the next question. Yeah.
I think I know what they mean, but I don't want to guess.
Yes. So we'll go to the next one.
Okay.
Is there any research that has tried to reduce COVID-19 stigma, particularly stigma directed towards East Asian individuals on social media platforms? And what is the relationship or overlap between those individuals promoting misinformation and those expressing stigma and advocating violence against marginalized communities?
So
two very long questions.
Yeah, but it's a great question, and so there has been some very interesting research, that is a little bit grim, that has highlighted the adverse impact of misinformation on, it has resulted in stigmatization, particularly for Asian communities, but even, more broadly. So I think this is a really important topic. And yes, as this question I think implies, and I think this participant is probably guessing this, the Venn diagrams do overlap. Unfortunately, there is a cohort of individuals, and you see this with the QAnon, alt-right. You have these clusters of beliefs that go together. And I think it's a really interesting and unfortunately very destructive aspect of the latter pandemic trends that we're seeing with misinformation being incredibly ideologically driven. Look, I'm not trying to say that everyone who has leans right ideologically or has these conservative ideology necessarily adopts these views, but we are seeing these kinds of correlations. There was an interesting analysis that came out not that long ago that really correlated it, not so much with conservative ideology, although that correlation is there, but more with the populist beliefs, and distrust of government, distrust of experts, that very much, the cliche is Trumpian, but we definitely are seeing that, and that has played out internationally also. So yes, unfortunately, there is that overlap. There is that, and one more quick thing. What more sort of bad news is we also know that it's more difficult to change people's minds once it has become part of their ideological worldview, and that's one of the reasons some people, and I agree with this, suggest it's really important to debunk something quickly before it takes on that ideological valence, before it becomes part of an ideological package of beliefs that you're supposed to have if you're part of that community, a particular community. So I think this is a really important point that this question touches on.
Absolutely. So the next one, have you looked at information about long-term care, in your work on COVID-19 messaging? Is ageism an issue in your work?
I think ageism is an issue in this, and there's been some really interesting commentary on this, and it's played out in a lot of really interesting and kind of scary ways. You probably saw it around, and we're actually studying this phenomenon right now, so this is the top of mind thing that comes out. But when people were talking about natural herd immunity, there was this horrific ageism associated with that, as if those who were old and most vulnerable were not worth worrying about, or not really worth the lockdown, I'll put it that way, or not really worth the preventive strategy. So you saw the ageism in that context. There was also really subtle ageism that people haven't talked about, how there's this presumption that people that were older that were going to be more vaccination hesitant. And we really saw that when the Gen Xers were so excited about it, saying the boomers, you didn't want your vaccine. That's not the case at all. In fact, those individuals in the older demographic were actually more accepting in the aggregate of vaccines, and for understandable reasons. But there is some ageism, and there's also some interesting ageism associated with belief in misinformation. Yes, there may be a tendency for the older demographic to be susceptible to misinformation, but in fact, a lot of research suggests that the younger demographic might be more susceptible, perhaps because of exposure, perhaps just because of the chaotic information environment they're faced with. But so we've seen ageism play out in a bunch of different ways. And again, it's something I hope that we learn from going forward.
So we do have a rephrasing of a question that we just happened to skip. So let's go to that one. So can't the same approaches you're mentioning be used by those promoting misinformation and debunking the facts?
Oh, yeah. Okay. So that's what I thought you were going. I should have jumped in and guessed. Forgive me. Yes, they can. And we've seen this happen already. I've seen it happen personally, right? Where people will use the strategies I've just talked about. They'll ape that, and they do it kind of also in a mocking way to debunk stuff that I talk about. So absolutely, you see that they co-opt the term misinformation. You've seen that with the word fake news, where people have co-opted, Donald Trump co-opted the term fake news, right? So this is a problem. So what we need to do, and these communities are incredibly nimble. The anti-vax community in particular, they're very nimble. They know how to do this. So we have to be vigilant, right? We have to watch it. Now, the good news is I still think everything I just said applies, right? The sad news is a lot, that 9 I have, a lot of they use a lot of that stuff already. They use narratives, they use humor, they use satire in order to push misinformation. So we need to continue debunking using good creative strategies to move it forward. But I absolutely take this point, and I think it's accurate, and we have to watch for it.
Okay, great. So we are over time. So I just want to take this opportunity, Dr. Caulfield, to thank you on behalf of the CanCOVID team and network. We'd like to thank you for your time to present to us on such a very timely and important topic. Also, just a few announcements. We do have a next speaker series, which is June 1st at 4 p.m. Eastern, to hear from John McLaughlin, and who's the executive director of CanPath, and Philip Adewale, who is the National Science Director from CanPath. So look forward to seeing you guys next week. And let me rephrase that, Tuesday, June 8th at 4 p.m. Eastern. Thanks so much, guys.
Thanks for everything you guys do.
Thank you. Bye, everyone.
We would like to thank our speakers and members of our network for their continued support and participation in Canada's pandemic response. If you are interested in learning more about CanCOVID or joining our Pan-Canadian COVID-19 Research Network, please visit our website at www.cancovid.ca.